Kia ora everyone, and welcome to our live chat about immunisations. It is World Immunisation Week this week, so that's why we've chosen this chat. We are going to have a wee korero about how to access immunisations for your children and a few other things. But first of all, I will get our wonderful guest speakers to introduce themselves. So Bernadette, can we start with you and what your specialty is?
Okay, kia ora, thanks Rosie. Ko Bernadette Heafy tāku ingoa. I am the Immunisation Service Manager at Whanau Whina Plunkett. I'm a registered nurse by background, and I've been vaccinating for all of my nursing career, which is now more years than I'd like to count. It's a topic I feel incredibly passionate about, and ensuring that we are protecting our tamariki, our whānau and our communities from vaccine preventable diseases. So it's great to be here, and it's great to be supporting this important mahi that Whanau Whina Plunkett is doing and rolling out. And it's really great to be here with Adriana, who's actually one of our on-the-ground nurses.
Yes, excellent. Adriana, can you tell us a little bit about you?
Awesome. Hi, my name is Adriana. I am a Plunkett nurse up in Whangarei and just a recently trained vaccinator. And yeah, it's been lots of fun diving into this side of nursing. Yeah.
Beautiful. Cool. And I actually forgot to introduce myself. I'm Rosie, and I am a nurse on Plunkett Line and a mum of two young ones. So today we will be talking about, as I said, how to access immunisations for your tamariki, a little bit about the immunisation schedule and how to keep track of which immunisations your babies have actually had, how to keep the actual act of immunising as low stress as possible for families, and a bit about common immune responses straight after vaccinating. So if we dive right in, Bernadette, can you tell us a little bit about the avenues that we can go down to get our pepe and tamariki vaccinated?
Okay, so there are a number of different places to access immunisations within the community. So there's your primary healthcare provider, normally your general practice, and they're probably the most common place that whānau access immunisations from. But there's also community pharmacies who offer a wide range of immunisations. Now, some do offer childhood immunisations as well, which is really exciting. Certainly a great avenue in terms of access for different hours, particularly for those working parents. There's also community clinics, and there are some events held within the community where immunisations are offered. So really lots of places. But I guess one of the things I'm excited to say is that, you know, as at Whanau Whina Plunkett, we are opening some sites for immunisations. So just let Adriana tell you a little bit about that.
Yeah, so it's very exciting to be part of this immunisation pilot. And so it's a little bit different all over the country. It's not a nationwide thing at the moment. But in Whangarei, we have Fridays, which are our immunisation days that our admin can book into. And then Hamilton also has a site down there that they're immunising, that they do Saturdays, which can be great for families and working people. But yeah, if you are struggling to find somewhere to take your babies to be immunised, you can definitely reach out to Plunkett Line or your nurse, and they'll point you in the right direction.
Yeah, and I think that's really key, is reaching out and asking the question if you are struggling to find somewhere to access immunisation services. So having a chat to your Plunkett nurse or to Plunkett Line. Within each area of New Zealand, there are what's called outreach immunisation services, and that might be an in-home service. And we're doing a little bit of that as well with one of our models for offering immunisations. And so your general practice, your primary healthcare provider, can refer you to an outreach immunisation service if you are having trouble accessing through the usual channels.
Perfect. Cool. That's awesome that there's an option for maybe whānau that don't have transport. That's great that there's an option for that. So can you tell us a little bit about what is on the schedule? Adriana, maybe
yeah,
you start off?
Yeah. So for us, we've got, because we see, right from babies up until they're 5, we've got 6 week until 12 months, which is always nice. And then 15 months and 4 years are kind of the ones that we cover. But yeah, it's all free, which is great and makes things really easily accessible for families. Yeah.
Perfect. Is it still free for families that perhaps aren't New Zealand citizens?
Yeah, absolutely. It's free for all babies.
Beautiful.
Yeah.
Awesome.
I think that's one of the really positive things within the New Zealand environment, is that acknowledgement of how important immunisations are in protecting both individual health but also across the population. So the immunisation schedule from 6 weeks through to turning 18 is free, and that's regardless of your immigration status. So whether your child's on a visitor visa or so the immunisations are free. There are other vaccines. So as Adriana said, there's schedule 6 weeks, 3 months, 5 months, 12 months, and then 15 months, 4 years. And then there's the adolescent program and vaccines available for adults. But there's also a program around BCG, which is a vaccine around preventing tuberculosis. And there's a special program for children under the age of 5 who are considered at higher risk from tuberculosis. So that might be something that your midwife talks to you about and refers you for the BCG vaccine. The other thing, very topical at the moment, flu. It's the influenza vaccinating season has started from the 1st of April, and so providers are well underway with that. While it's not free for all tamariki, those who are at higher risk are eligible, and it's worth having a conversation with your primary care provider around whether or not your child's eligible for influenza vaccine. One thing I'd say is if your child's got significant history of significant respiratory illness or hospitalisation for a respiratory illness, then and they're under the age of 4, then it's certainly they would be considered eligible. So really important to think about flu. It's a bit of a nasty. It is starting to circulate. And you can purchase flu vaccine from pharmacies or your primary healthcare provider.
Cool. So when you say eligible, you mean more eligible for it funded, don't you?
Yes, I do.
Anyone can access it paid, can't they?
Yeah. So the flu vaccine is available for use from 6 months of age. But yeah, there's a set criteria for those who are able to get it for free.
Awesome. Cool. All right. So you said talking about a lot in the media with flu. We've also seen a lot in the media with measles, haven't we?
Sadly, yes.
Yes. So as we know, measles is in the MMR is in the 12-month and 15-month. Is there options for babies to get it earlier than 12 months if there is an outbreak?
So if an outbreak was declared or there was a case in New Zealand, then a decision is made by Health New Zealand or the Medical Officer of Health around eligibility for early MMR vaccine. What I'd say is that at the moment, we've been really lucky so far. The cases that have come in have not spread widely, and they've been able to be managed by public health. I believe we did an earlier podcast, Facebook Live with Dr. Owen Sinclair around measles, and he talked a bit in there around eligibility criteria. So I think it's just important to know that if there is a situation with measles in New Zealand, a decision would be made around something like that. In the meantime, the most important thing you can do is immunise your child on time. So as Rosie said, 12 months, 15 months is when that vaccine is on the schedule. And if you've got worries or concerns, or if you're travelling, to somewhere where there is currently a measles outbreak, then please discuss that with your primary healthcare provider before you travel. It's a good, important conversation to have.
It's also worth checking as adults whether you're up to date on all of your immunisations, isn't there? And I think there's a quiz on the Te Whatu Ora website that should give you a bit of an idea.
Yeah, it can be hard trying to find those old records and, you know, suss out whether or not you've had your 2 doses of measles-containing vaccine. So, yeah, worth doing, and just checking out that you're protected as well.
Yeah, beautiful. Cool, thank you. Right, so there's quite a few immunisations through that first 4 years. How do we keep track of them, or how do parents keep track of them?
Oh, if only there was just one easy answer to that. But hopefully every time you go and you take your child to be vaccinated, that you take along your well-trialled tamariki or a book and they fill out the page in there. And so that's a really good source of information for you to have at home of what your child has had. In New Zealand, we have the Aotearoa immunisation register. So vaccines that are administered are given here are entered onto that register. And if your child's come from overseas, they can enter the overseas immunisations that are done as well. So there's a national register around what's been given, which is so handy. Like for nurses like Adriana to be able to look up and, you know, see the history of what a child's had is, you know, without a national register, it is extremely difficult. But there's this really cool tool on Health New Zealand's website. And if you've just got a new baby and you're thinking, oh, when are their IMS due? You can actually go onto the website, enter your child's name, their date of birth, and it will create this beautiful little picture of when your child's IMS are due. And so just something you can pin up on the fridge or just, you know, note down those dates so that you're like, yep, that's what I need to do. So, yeah, it's a really cool, helpful tool. But if you think you've missed out, you know, don't hesitate to ask the question when you're next in with your primary healthcare provider, or even potentially if you're visiting Adriana, ask her.
Now, Adriana, can you tell us a little bit about how parents can go to catch up if they find that their children are running late on their immunisations?
Yeah, definitely. So you can reach out to any of your health providers. We've all got kind of access to that national register, and it's never too late to catch up on them. We can always make special schedules to kind of accommodate what baby needs or, you know, what your toddler needs. And so, yeah, it's never too late to catch up and can be really important to kind of get them back on that schedule.
Yeah, perfect. Cool. Can you tell us a little bit about how you make these appointments a little bit more stress-free? I mean, we all know that it's hard taking our babies, but as you say, it's really important. So how can we make it as low stress as possible for everyone involved?
Yeah, absolutely. So yeah, we all know that immunisations are not the funnest thing, but we also know that it's really important to keep your baby healthy. We've had a lot of feedback through Plunkett about how they've really enjoyed that kind of, they already have that relationship with Plunkett and their well-trialled nurses, and so that can make the experience a lot easier for them. It's a familiar environment, they know us, and we also get to have that time to really talk things through with them, whether it be in the immunisation appointment or in a well-trialled appointment with them beforehand. So yeah, we've had lots of good feedback around that, and I think it's just all about open communication with us. If you have any questions, ask. We'll happily answer them.
Beautiful. Yeah, I imagine it's a lot easier for some parents when they know the person vaccinating them is a lot more comfortable. Anything to add, Bernadette, about making it easier?
I think probably for me, one of the things that makes things easier is the opportunities for mama to be able to breastfeed or bottle feed their infant while they're being vaccinated. And that's the whole before, during and after process. And it's about that comfort and that feeling of familiarity. It doesn't work for all mama, but it is something that is comforting for the child, and certainly something I think our nursing team are encouraging for mama to explore. I think for older kids, it's a little bit tricky. You know your child best, but in general, letting them know what they're going to, so it's not a big surprise, and talking them through the process that yes, this is going to be a bit ouchy, but this is about making sure that you don't get sick. It's around trying to prevent an illness that I guess my big thing with the slightly older children's, and particularly thinking about like the 4-year-old event, is bribery and corruption the whole way. So, whether a treat or a new pencil case or a colouring in book, or they get to choose what to do on the weekend or something, it's just that, let's just gain a bit of cooperation with them. I know it probably sounds terrible, but yeah, I think it just helps get them on board with the process. And I think it is important that you think about the best way that your child will handle it, because you know them best. You know what settles them. You understand their process. So, and it's communicating that really clearly with the person who's immunising your child as well. We love to give out stickers, blow bubbles, but it doesn't work for all children. But it is certainly something that is, is often on offer at immunisation events as stickers or bubbles. I mean, I'm so old, I remember giving out jelly beans. So, but I don't believe dental will like that. No. So, yeah. But yeah.
No. But as a parent, that is your prerogative.
Absolutely.
Adriana, do you have treats or things in clinic that you give out when the kids are being vaccinated?
Oh yeah, we have lots of stickers and big sticks of bubbles everywhere. So that's our kind of thing. We'll get someone to come in sometimes, another nurse to come in and blow bubbles around and be a distraction while we get the IMS done. So it's great.
Perfect. Awesome. Sounds good. All right. Can you tell us a little bit about like the normal responses to immunisations and how babies and kids might be feeling in the few days afterwards?
Yeah, so with the immunisations, the most normal symptoms you'll find are unsettledness, sore legs and arms. And so that's when we say that lots of feeding is really good, lots of cuddles. You can use the cold compresses on their legs if they're sore. And also with the new meningococcal B1, fevers can be quite common afterwards. And so that's why we're recommending the PAML to just kind of help that along. But yeah, it's mostly for our babies. It's just lots of cuddles and feeding and tending to them when they need it.
Beautiful. If you're not sure about your child's response after, say, you get home, what can you do about checking that it is normal?
I think one of the things is that you will be given an information sheet by the person who's immunised your child, so you can check that. But it's not hard to lose those pieces of paper, but you can certainly give Plunket Line a call and talk through your concerns with our staff there. You can ring back your primary healthcare provider where you had the vaccinations done. But Plunket Line's a great source and they're available 24/7. A lot of the things that we see after vaccination are actually related to the child's immune response. So it's actually, things like soreness and redness at the injection site that's around the baby's immune system going, oh, there's something there that I need to deal with, and allows them to mount a response and create that protection. And same with fever. It's a normal response to illness or to vaccination, and it's part of that immune system response. But if you're worried or concerned, just give someone a call and ask the question. The other thing just to say is that whenever you do take your child or yourself even in for a vaccination, you will be asked to wait afterwards. With childhood IMS, it's a 20-minute wait. And that's just because there is a small risk of allergic reactions, and it's much easier and simpler to deal with that in the clinic setting or with the nurse if they're vaccinating at home, staying in your home. And so they're trained and able to deal with that and that severe allergic reaction. So that's just an important thing to remember. I guess it's one of those things to factor in when you're thinking about planning your day and taking your child for immunisation, is just knowing that you're going to be waiting that 20 minutes afterwards. And again, for those older children, something to colour in, distract them from sitting in the waiting room. I think that's the nice thing that I've seen about the vaccinating at the plunket rooms, is the opportunity to play with all of those playthings and the play areas at the plunket rooms. So yeah, nice child-friendly environment.
Beautiful. Yeah, better than some GP offices that don't have toys sometimes, which is sad. I can understand why. But
oh yes, yeah. It's a challenge to clean them all, I can assure you.
Yeah, absolutely. All right. So if anyone's got any questions, if you just pop them in the comments, we can stick around for a minute or two to answer those ones. Any final advice from either of you?
I think my biggest piece of advice around,
I guess
around immunisation.
Sorry, my Wi-Fi is so bad right now. I'm cutting it out. You go, Bernadette.
Okay. So I guess my last sort of piece of advice is just ask the question. If you've got any worries or concerns, whether that's before immunisation or afterwards, have a conversation and discuss and work through any questions that you have. Whānau Whina Plunket is here to help you make an informed decision around immunising your child. And we all want the best for our tamariki, for our whānau, for our communities. And I think that's an important thing to remember for all parents, is that we're coming from that perspective. We're doing our best for our tamariki.
Absolutely. And another reminder I harp on about a little lot, but plunket line 24/7. If you wake up in the middle of the night with a question, pick up the phone. It's fine. Absolutely fine. That is what we're here for. Sweet. So we've had no more questions, so we might wrap up. Thank you guys so much for your expertise and advice. And we will wrap up, and thank you everyone for watching, and have a lovely day.
Thank you, Rosie.